Euthanasia means producing painless death of a person suffering from hopelessly incurable and painful disease called as mercy killing. Active, positive, merciful act, useless suffering or for a meaningless existence. Active role, active or commission, role of the doctor. By giving large amount of drug to hasten death, Belgian and Dutch have created a protocol that recommends sodium pentothal as an ideal agent to induce coma followed by chloronium bromide. Using measures that would hasten death. Netherlands first country to legalize it, Belgium. Passive euthanasia, discontinuing or not using extraordinary life-sustaining measures to prolong life. Passive role, active of omission. By withdrawing life-saving measures to prolong life. Not using measures that would delay death. India in some state of USA. Classification, voluntary. Individual request euthanasia, either during illness or before it, if complete incapacitation is accepted. Non-voluntary. Individual is incapable of perception and feeling and hence cannot decide or distinguish between life and death. Such a person cannot give informed consent. Involuntary. Individual may distinguish between life and death, has not consented for the mercy killing, ethically, morally and legally considered murder. Arguments about euthanasia. In favor, reasons for euthanasia. The person should be allowed a dignified, painless death instead of prolonging the same through torture of unbearable pain and disease. High cost of medical treatment may pose an economic and psychological burden on patient's family. Right to commit suicide. Patient should not be forced to stay in view of limitations of medical science inability to cure all diseases. Against medical ethics, rapid progress of medical science can cure a disease which is incurable today, can be misused by doctors, coming hand in glove with the relative to commit murders, becomes a means of healthcare cost containment, may become non-voluntary, degrades importance and value of human life, crime against society and equivalent to legalizing murder and suicide, will encourage people to commit suicide. Supreme status in India. Supreme Court of India, in a landmark judgment on 9th March 2018, allowed passive euthanasia patients with a permanent vegetative state but rejected active euthanasia. According to the set guidelines by Supreme Court, a person can make a living will or advance directive or in presence of a first-class judicial magistrate deciding the course of action to be taken in a case of permanent vegetative state. Medico-legal importance. Euthanasia in a clinical ethical dilemma of a medical practitioner who was sworn to save the life of a patient. Term physician-assisted suicide is often used interchangeably with the euthanasia, wherein patient himself consumes a fatal drug prescribed by the doctor. Thank you.